Following the declaration of COVID-19 as a global pandemic, the Ethiopian government imposed state of emergency, which nearly lasted for 6 months in order to contain the spread of the virus among the community. So as a result of this, really millions of daily workers, employees of those informal sectors were exposed for immediate economic needs and threatened their lives. We as Freedom Fund, we mobilized and invested 229 USD for Ethiopia Hotspot program. The support was provided in 3 rounds through 10 local implementing partners. The support mainly focusing on immediate relief supports like provision of different food items and protective and sanitation materials, which can cover for 1 month. We did also some advocacy activities in order to improve the knowledge and understanding of the community about the pandemic and its natures, and as well how to apply WHO protocols and guidelines and government advices in order to prevent and contain the spread of the virus.
Due to a sudden lockdown imposed in the month of March, more than 10 million migrants had left with no option but return to their native states in India. This huge influx of migrants to villages started in April, and administration was not prepared to handle the situation to that scale, especially to arrange quarantine centers for these migrants, providing for their medical and physical needs. Sudden lockdown hit our communities really hard, which comprises of daily wages, and due to various reasons, government relief was delayed to reach to all the community members of our working area. In the first week of May, the relief kit distribution was started in the communities by our implementing partners with the support of the Freedom Fund. Apart from essential materials along with food grains, we included hygiene kits for adolescent girls, and 40% of our communities in Bihar were affected by flood and their houses were damaged. Therefore, tarpaulin sheets were included to protect them from heavy monsoon.
Freedom Fund in Thailand, we try to provide accurate information to migrant community. We have worked with 6 partner organizations and we are able to reach out 13,000 workers. We have provide from emergency relief, PPE kits, basic knowledge on sanitation and hygiene. In addition, we have tailored the legal services to provide legal counseling to migrant workers who lost job or who are unable to claim their social security benefit. This is quite unique from other emergency relief. We want to incorporate labor right protection in all areas that we have worked. In addition, we also support migrants who express interest to return home to be able to register with the embassy. We provide transportation for workers to be back to the border, as well as we try to monitor whether workers have made themselves to their home in the origin country safely. Freedom Fund will continue to work with the Thai government to ensure that even migrant workers are in the distressed situation, they still be protected by Thai law, as well as employers will show the responsibility to support migrant workers while they're remaining displaced in Thailand. And migrant workers should be able to register and continue the right to stay in Thailand, even though they may lose a job due to the unforeseeable situation. In addition, Freedom Fund and Hotspot partners have been working with the Thai media to bring attention to migrant workers who may not have voice heard in Thai communities, and we will continue to do so because it's very important that none of the people in Thailand to be left behind during the distressful period.
Greetings from South India Hotspot. We work in 450 villages through 13 partners. Our main target group are people who are working in cotton, and garment industry. This includes people from local communities and migrants. COVID-19 has affected the lives of people phenomenally around the world. People in the cotton industry are affected badly because they hardly have any savings from the meager income. Dry ration and personal protective equipments are provided to around 86,000 people in the 450 villages. And livelihood support opportunities have been provided to 8,500 people in the villages. This emergency response program helped people to have 3 meals a day. Otherwise, they were forced to take 1 meal a day because of COVID-19 and lockdown.
Informal sector workers were the highest impacted due to the unavailability of food and work during the onset of the pandemic. The total funds that were distributed during the 3 rounds of emergency relief fund were about 97,000 US dollars, and the total number of beneficiaries that were reached out to were 22,500 approximately. Free food distribution, cash transfer, free mask distribution, and mask making and providing livelihoods was possible through the efforts of the partners. Advocacy related work was also undertaken by the partners. The staff members of the partners provided communities with information about the pandemic and the preventive measures. Women had no work who were working on embroidery, tailoring, etc. And at such times, livelihood support was provided through Access Development Services and Seva Bharat, our partners on ground, for making of masks by them from their homes. About 90,000 masks were made for freely distributing in the neighborhoods by these women, and maximum that a woman could earn was rupees 6,000 by devoting 8 hours a day.
No Brasil, a pandemia da Covid-19 desencadeou uma tragédia social sem precedentes. Nas periferias e favelas, as condições precárias de moradia e saneamento dificultaram enormemente o isolamento social e as medidas de prevenção. E o Brasil rapidamente se tornou um epicentro global da pandemia. Em todo o país, milhões de pessoas perderam suas fontes de renda. Para piorar, o preço dos alimentos disparou. As denúncias de pornografia infantil no Brasil mais do que dobraram, já nos primeiros meses da pandemia. E o maior tempo de crianças e adolescentes online sem supervisão aumentou a possibilidade de acesso a conteúdos inadequados e a aliciamento online para exploração sexual. O Fundo de Resposta Emergencial do Freedom Fund veio atender às necessidades das famílias de garantir alimentos, materiais de higiene e equipamento de proteção no momento em que a pandemia explodia de forma descontrolada no país. Com o apoio do Fundo Emergencial, nossos parceiros na linha de frente articularam uma grande rede de voluntários para a distribuição solidária de alimentos e suprimentos às famílias que mais precisaram. Com isso, conseguimos proteger mais de 2.000 crianças. Realizamos uma grande campanha de informação alinhada com as orientações das autoridades sanitárias para contribuir na prevenção à infecção pelo novo coronavírus. E promovemos mais consciência sobre os riscos da Covid-19, maior uso de máscaras e higienização das mãos nessas comunidades. Orientamos as famílias a redobrar o cuidado com as crianças e adolescentes, a estarem atentos para identificar e denunciar as situações de violência doméstica e sexual e a intensificarem o autocuidado e o cuidado uns com os outros. Aprendemos que as redes de tráfico e exploração adaptaram suas estratégias à pandemia e que a sociedade civil terá que estar ainda mais forte, unida e vigilante para cobrar das autoridades a proteção prioritária dos direitos das crianças no desafiante período que temos pela frente. Ao mesmo tempo, testemunhamos o poder transformador da solidariedade, da mobilização social e do protagonismo de crianças e adolescentes e jovens para influenciar mudanças e atitudes nas suas comunidades.